We particularly, the two areas that we just have to stay focused on is number one, oversight and safety. We have a 9% increase this past year just in our senior adult abuse and neglect and exploitation hotline. We have to answer those calls. We have to make sure that people are protected. I just told you all the healthcare institutions where it's our responsibility to survey them and make sure that people who are in very vulnerable situations, they're sick, they're aged, they're young children, that they are safe. And we focus on that all the time. In the public health arena, we want to make sure that you can go in a restaurant and have some assurance that you're not going to get sick from the food. So we do have legislation to update our food safety code. So we're constantly honing in on making sure that all of that oversight and safety component of the department, that we can still fulfill that part of the mission. And also, of course, we want to move ahead, and we want to be sure that people are healthy and that we can actually move forward in the state. And so some of the money which has come in from the federal stimulus package has really helped with that. So we've got additional money for WIC, and we actually, I'm pleased to say, in October, we went to a much broader and a much more nutritious food package. So it might surprise you that in the past you couldn't get whole wheat products, you couldn't get fruits and vegetables through WIC, you now can. And that caseload has grown, and we've gotten additional federal money to help with that. In the child care area, Ron may talk about this, you've got federal stimulus money to actually help, of course, pay for people to have child care. Critical in this economy. But in addition, there's money under our licensing arena to help improve quality. So we're going to be doing several initiatives to be able to put on, to buy the software to put online what parents, so parents can actually see citations that have been made for child care centers, so they have a better way of looking at that center and trying to decide if they would want to use it as a facility. It may surprise you, we can do that in the long-term care area. You can't do it right now with child care. So that's one step forward. We're also going to be doing work with the centers on just building a curriculum about social and emotional competency, which the new research indicates is so critical in early childhood, and that it's actually the most important predictor of whether the child will have success, even economically, obviously in personal relationships. So we're very excited that we have the opportunity through the federal stimulus funding to be able to do that work. In the area, we are committed to making sure that people can age well and can be as independent for as long as possible. There was money that came in to help with the congregate and home delivered meals that are out through the AAAs. Since the money was cut at the state general revenue level, this helped them to at least stay even. Didn't really move it much forward, but at least helped to soften that blow. There's also been a significant increase in the amount of money that's been invested in helping older adults who want to return to the job market or may need upgrading of their skills. So it's a subsidized employment program that is specifically targeted to older adults. So that has also been very helpful.